Hi, I'm Dr. Whitcomb, and I have good news for fibromyalgia sufferers. I have 4 studies that were conducted in my office that I'm making available to you right now, and you can click on the links for the different studies and take a look at them. The first study is a study we did on 74 patients, and we took every symptom that we could imagine to ask about and put it down and then looked at those symptoms. Some of them were fibromyalgia symptoms, some of them were maybe old knee injuries, that type of thing. And you can see the difference between the start of treatment and the finish of treatment on these 74 patients, and I think that the results are absolutely staggering. If you'll go, it's actually quite a long study, around 200 pages. If you wanted to print it, it'd be kind of difficult, but you can look at it on your computer. And if you go to the end and on the bottom right, you'll see the frequency and intensity of those symptoms, how they had decreased with our treatment. They're around, just to give you a hint, they're around 77% decrease in symptoms during treatment. Our next study was a study that we did with weekly reports. Now, these symptoms were more focused on fibromyalgia symptoms. Overall, it ended up being over 80% of the patients had a reduction in symptoms of 85% or more. I think that's the way I remember it. You can look that one up and see exactly. The next study was a study we did on surgery, which is really an interesting thing. I didn't really think about this until we started taking notes and doing studies, but a lot of the patients had significant findings on surgery. So if you're interested in what might happen if you have surgery, or taking a look at what did happen when you have surgery and what all my other patients found also, you can take a look at this surgery study we did in the office. All these studies were done by patients filling out forms and answering questions, and then we would just put that data directly into spreadsheets. The last one was a study we did after patients went home. We called the patients and we sent them letters, and then we took the information from that, put it down in spreadsheets, and you can see how well they kept their recovery after they had been home. We couldn't put an exact time to say this is, so we put the times, instead of saying every single patient this is for 3 years, we just called all the patients, wrote down what we had with the patients that responded, and you can see exactly how well they've kept their care. So some of them got sick again, some of them got better, some of them stayed the same, but you can take a look. We don't include any names, of course, in these studies, but you can take a look patient by patient, and we have all the documents still to back all that up. So take a look at this. It's really exciting news. I think it's absolutely dramatic, and thank you for following.